Hello and welcome to Yashoda Hospitals. I'm Pratyusha Chaudhary hosting Nursing Education and Training webinar series live on Facebook every Thursday at 3 p.m., bringing forth the most interesting topics. Thank you for joining us today. Stay tuned till the end for the expert discussion. Also, you can put forward your queries in the chat section so that we can address it at the end of the webinar. Medication administration is the core competency for all the nurses required in every clinical setting. It is also a key skill required in safely dispensing the drug dosages with accurate dosaging. Even though we have got new technologies as a barcoding administration, also with the smart infusion pumps, which helps to reduce the medication errors. Still, however, the nurses cannot rely on these completely based on the advances. So we have got put forward our topic for the day as calculations made easy, which you can do it manually without the help of the advanced technologies also. So without further delay, I wanted to introduce you to the pros for today's webinar. So for our expert panelists for the day, Dr. Sai Kiran Sir, Consultant Critical Care Medicine, Yashoda Hospitals. Looking forward for your valuable inputs, Doctor.
Thanks for having me. Good afternoon.
I'm glad to introduce the speaker for the day, Ms. Himabindu, Program Coordinator, Nursing Education and Training Department, Yashoda Hospitals, who holds more than a decade of clinical expertise and a vast nursing educational background. I request you to take over the session and make us energized with your talk. Over to you, Bindu.
Thank you, Pratisha. Good afternoon, everyone. As you all know about today's topic, it's all about calculations. And as a nurse, we are the one who are going to handle so many medications every day. So to avoid medication errors or to prevent medication errors, we have to know about the calculations. And the main part is how to calculate and how to adjust the drop factor. So now today's topic, we are going to discuss about how to calculate the drugs and how to adjust the drop rate and also about the infusions. So without any delay, we'll move into the topic now. So before starting our topic, our main points is today's metric conversions, tablet and liquid calculations, concentration of the drug, and also about the fluids. In the fluids, we'll discuss about flow rate and drop factor. So how to adjust the drops per minute, we are going to discuss. And the last but not the least, all ICUs, we all should know how to know about the infusion calculations. So let's start our topic. First point is about metric conversions. So here, there is nothing to teach much about it. You all can take a snapshot regarding this. And here, the main principle about metric conversions is any value we are converting from smaller value to higher value, we have to do the division. In the same way, we have to multiply if we want to convert from higher value to lower value. So that is the main concept we have to remember regarding the metric conversions. So I hope everyone has taken the screenshot of this. The first about tablets formula. Whenever the doctor is advising regarding the tablets, if we want to administer the exact and the correct dose, we should know how to calculate it. For example, the doctor has been advised ethambutol at 200 mg to administer. So how we are going to calculate it? The formula for this is required dose divided by stop dose will gives you number of tablets to administer. When it comes to the required dose, whatever the doctor has been advised or prescribed, that is required dose, and available in our hand or in pharmacy, that is stock dose. By calculating this, we'll come to know how many tablets we need to administer. Let's have an example for this. Doctor advised to administer tab Ondam 4 mg and it is available as 2 mg. How many tablets the nurse should administer? As we look into a formula, required dose divided by stock dose. So it's been clearly mentioned, advised. So how much it has been advised? It's 4 mg and the available dose is 2 mg. So whenever you're calculating anything, these two things we need to identify first. What is the dose the doctor has been advised and how much it is available in our hand. We have to do the division. So there we are going to get our answer. It is 2 tablets, 4 divided by 2. So this we should make it. So I hope it's clear. The formula is required dose divided by stock dose. These are the two main concepts we have to remember regarding the tablets. The next is liquid medications. Whenever we are having any liquid medications like hydrocortisone or heparin, so we should know how much ml we should take. So here the formula is required dose divided by stock dose into stock volume divided by 1. So here required dose, again the same thing, what the doctor is advised, the dose. Then stock dose, whatever it is available in our hand. So the dose that is available in our hand is stock dose, and the quantity of the drug is stock volume. So for example, injection Zofor, it is available as 4 mg and 2 ml. So 4 mg is our stock dose and 2 ml is our stock volume. So that we should know, whatever it is available in our hand, the dose of the drug is stock dose and the quantity of the drug is stock volume. So the formula is required dose divided by stock dose into stock volume by 1. So let's apply it in the formula. Doctor advised to administer injection hydrocortisone 50 mg and available is 100 mg per 5 ml. How much the nurse should administer? So the doctor advised is 50 mg. Available dose is 100 mg per 5 ml. So 50 into 5 divided by, 50 into 5 divided by 100. So we'll give the answer. So the answer is 2.5 ml. So that is how we are going to get the answer. The next is concentration of the drug. What actually we'll come to know about the concentration of the drug? By this, we'll come to know what is the ml per mg. I mean, in 1 ml, what is the mg that you're going to administer, that we are going to find out in case of the concentration of the drug. Here the formula is weight by volume. Weight indicates the dose of the drug that is available and volume indicates the quantity of the drug. So weight is not, don't think about the patient weight. It's the dose of the drug that is available in our hand. Simply, we can remember as stock dose divided by stock volume. That is how we can remember the formula. So let's have an example again. Injection morphine is ordered 5 mg and available as 10 mg per 4 ml. What is the concentration of the drug? So here we should not consider the whatever the doctor has been advised, but we have to look into the available, whatever it is available in our hand. And we have to apply 10 divided by 4, 2.5 mg per ml. So per ml, what is the mg, the dose that you are going to administer, that you can find out by using the formula of concentration. Then the next important one is fluid calculations. So every day on regular basis, we are going to handle. We need to adjust a drip rate. Like per minute, we are going to adjust, even we can find out the flow rate. Within 1 hour, what is the amount of drug that we are going to administer? So for this, the formula is for the drops per minute. GTT, even we can say it's in drops per minute. So the formula for this is amount of fluid into drop factor divided by time in minutes. And to find out the flow rate, the formula is total amount of fluid divided by time in hours. Sorry, it's not in minutes. It is time period in hours. Yeah, here first we'll discuss about the formula, amount of fluid. For example, if the doctor has been advising you the flow rate like 500 ml NS at the rate of 60 ml per hour. So whenever the doctor is advising you the flow rate, we have to consider the flow rate. So that's why here in the formula, we didn't mention the total amount of fluid. We just mentioned as amount of fluid. Sometimes for the complete amount of fluid, like 500 ml to be over in 2 hours, then our amount of fluid is 500. But if in case the doctor is advising the flow rate like 50 ml per hour, 60 ml per hour or 70 ml per hour, we have to consider only the flow rate. We should not go for the total amount of the fluid. So that's the main thing we have to remember. And the next one is drop factor. Drop factor, it depends upon the IV set, whatever we are using. We're having different types of IV sets, like macro set and micro set. Macro set, we'll use it for the adults, and the drop factor for this is 20 drops. In case of micro set, it is 60 drops. you can just identify the difference between the macro and micro. In micro set, where in the chamber we have the needle and the drops will be very small. So that's 60 drops is equal to 1 ml. So that's about the drop factor. Based upon the IV set, we have to decide. Adults mainly will go for the macro set, and in case of pediatrics, we will use the micro set. But in adults also, we will use the micro set when we are using for any additives like KCl or else any inotropic. If you are adding in 100 ml of NS or 500 ml of NS, we need to prefer micro set. Then the time period should be in minutes, because as we are going to adjust drops per minute, we need to have our time period in minutes. That's about the formula for drops per minute. Next is ml per hour. So within 1 hour, what is the amount of fluid that we are administering? So for this, the formula is total amount of fluid divided by time period in hours. I mention again, it is hours. It's not the minutes. So whenever you're noting, please make it. It's time period in hours. So let's have an example of here. So we need to administer 5% dextrose 1000 ml to be infused over 24 hours. So how we are going to calculate the flow rate and the drip rate? By using the drop factor of 20. So first, we should know about the amount of fluid, and the amount of fluid is 1000 ml, and the drop factor they mentioned has 20 drops per minute. Time period they has given in 24 hours. So here, hours we have to convert into minutes. So 1 hour, 60 minutes. So we are multiplying with 60, 24 into 60. So overall you need to apply, then our calculation is 13.8 drops per minute. So where in minutes we cannot adjust in the IV set. So we are just making it as a round figure as 14 drops per minute. So whenever you're noticing after decimal point, if it is 5 and above, you need to add +1. If it is less than 5, take it as it is. If in case it is 13.2, then it is 13 drops per minute. So the important thing is after decimal point, if it is 5 and above, then you have to make it as a round figure. So you need to add +1. If it is less than 5, you can take as it is. So that's
got a doubt in this. When we are trying to add up with this, in case if it is a pediatric dosages, can we do the same?
Pediatric, again, it differs, where you are going to use a pediatric drip set and a completely exact rate you are going to maintain. So we are not going to make it any complete round. You're not going to add anything for them.
One more query. In case if the doctor has advised 10 ml needs to be infused, KCl. Okay. 500 ml is the NS. So how would they dilute it? Either they have to directly get it into the NS bottle, or they have to take out this 10 ml normal saline from the bottle.
No, they are going to dilute it in the NS. Like they have to take the 10 ml of KCl and they are going to add it in the NS.
So before that, they have to take out 10 ml of NS from the bottle. So they have to discard it, and addition of 10 ml of KCl.
Yeah. So overall, the amount of fluid should be the same. Because 10 ml and 10 ml, again, it will become as 510. So we are going to take out 10 and we are going to add this.
Yeah. Great. Please continue.
Okay. Yeah. Then next, to find out the flow rate. The flow rate, the formula is, as we discussed, total amount of fluid divided by time in hours. Total amount of fluid is 1000 ml and the time period is 24. So 1000 divided by 24, it's 42 ml per hour. That's about fluid calculations. So I repeat again the formulas. For drops per minute, the formula is amount of fluid into drop factor divided by time in minutes. And to find out the flow rate, the formula is total amount of fluid divided by time period in hours. The next, it's inotropic calculation. So here, the formula is desired dose into patient weight into time period into stock volume divided by stock dose into 1000 will gives ml per hour. So why all these things in our formula like patient weight, time period, stock volume? Can anyone give the answer? So you can drop your answers in the chat box. Yeah. So if you look how the doctors are going to advise, they'll advise us 2 max per kg per minute. Only for 1 kg, the doctor will advise the dose. So in such case, to administer the complete exact dose for the patient, we are multiplying with patient body weight in our formula. Then according to that, the time period into 60, as we are going to dilute. So the dilution volume will be 56, like 50 ml of NS, then divided by stock dose into 1000, then 1000 in our formula. So in the first thing, metric conversions, we had seen that. So here, desired dosage is in mcg and stock dose in mg. We are just converting mg to mcg by multiplying with 1000. So this about our formula. And here, if you notice, there is a small difference for the NTG calculation, nitroglycerin. We are not going to consider the patient body weight in our NTG calculation. Why we should not include body weight in the NTG calculation? You can drop your answer in the chat box.
Nobody is answering. I hope you should answer.
Okay. NTG here, we are not going to use we are not going to administer the maximum dose. Here we are going to use only for the body volume, as the blood volume in all the adults will be the same, and we are not going to adjust the maximum dose. We are just using the NTG to adjust, like to manage the blood pressures. That's the reason why we are not using the patient body weight in NTG. So remember everybody, the important point, for NTG calculations, you are not going to add patient body weight, and rest everything is same. So let's have an example over here. Dopamine 2 max per kg per minute, where the patient weight is 60 kgs. So in 50 ml of dilution, what is the ml per hour? Dose. If you remember our formula, dose into patient body weight into time into stock volume divided by stock dose into 1000. So 2 into 60 into 60 into 50 ml of stock volume divided by 250 dose into 1000. So that will give us our answer. It's 1.4 ml per hour. Even you all can do it. Yes, till now we had discussed about all the formulas about tablets, liquid medications, concentration, fluids, and about infusions. The last thing is about fluid maintenance in pediatrics. The formula here, main rule is 4-2-1 rule, where we are going to use. For hourly basis, it is 4-2-1 rule. Less than 10 kgs, it is 4 ml per kg per hour. For 10 to 20 kgs, it is 40 ml plus 2 ml per kg for every kg less than 10 kgs. Then more than 20 kgs, it is 60 ml plus 1 ml per kg. 4-2-1 rule we have to maintain for fluid maintenance in pediatrics. This is for hourly and this for daily basis. You can have a look over here, the example as well. The infant weighing of 5 kgs, how we are going to maintain a hourly fluid maintenance? So 4 per kg per hour. So 4 ml into 5 kg, 4 into 5, 20 ml per hour. That is how we are going to maintain the hourly fluid maintenance in the pediatric patients. The rule is 4-2-1 rule. I hope it's clear that. Yes, now we are done with our topic. I expect if you're having any queries, you can just drop your questions in the chat box.
So let's welcome our expert panelist, Sai Kiran sir on board. So we also wanted to discuss what are the main challenges that you see commonly on floor when you go to the critical care area that the nurses are facing in dosage calculations, so commonest one.
Yeah, good afternoon. First, I would like to congratulate the speaker, Himabindu. I think it's a very clear presentation, a very lucid presentation. And I'm sure it will be of immense benefit to all the nursing students and budding nursing staff. Very good job, madam, on that.
Thank you, sir.
Some of the challenges that we face in the ICU on a day-to-day basis are for the young nursing students, because as doctors, we are used to prescribing any medication in terms of mg. and that has to be converted into the ML. So there's always this confusion and a bit of thought process that goes into of how to convert that mg dose into an ML dose. For some of the commonly used medications such as dobutamine or noradrenaline, we have some blind rules such as dilute 4 ampules of noradrenaline into 46 ml or 44 ml of NS and then prepare a pump. But the ideal way is, as Madam has explained, converting the dose into an ML is very important. Sometimes that takes time. So over the years of experience, nursing staff have prepared certain blind rules to prepare the infusion quickly, because in ICU things are in an emergency scenario. But if you practice this on a daily basis, probably it won't be difficult, because it's always ideal to discuss about medications in terms of mg rather than ML. Even in the bedside, even doctors are used to the practice. We say Norad is going at 5 ml per hour. Somebody says 10 ml per hour, but it's not a standardized dose. For the infusion pump that we have prepared, 5 ml may mean one thing in one hospital, 5 ml may mean something else in a different ICU. So it's always good to speak of in terms of mg. And I think young nursing staff still lack in that aspect, and they should pick up this thing of converting the mg into appropriate dose of ml per hour, and then express that in terms of mg, though the infusion is going at ml per hour. That is one thing. Madam, I think has covered most of the points, and a couple of things I would like to add is that when she mentioned inotropes calculation and infusion, when we are administering inotropes, the other important point is to check the patency of the peripheral line, because inotropes are very high concentration medications, which is why we use it as an infusion. So sometimes if the peripheral access is not very great, if it's a very small gauge cannula, then probably there can maybe discomfort, there may be extravasation. So it is also important on the part of the nurses to be extra aware when they're using infusions, to keep checking and monitoring the access line, whether it is a central line or a peripheral line, if the line is adequate, if there is some extravasation that is happening, because most of these are high concentration medications, and any kind of extravasation may cause a bit of soft tissue injury. Another concern sometimes that we have is, let's suppose an infusion is going on at a fixed rate, and if it's an inotrope such as noradrenaline, and fluid bolus therapy is something that we use pretty routinely in the ICU. And when we ask the sister to administer, let's say 300 ml of fluid bolus, sometimes they may administer the fluid bolus in the same line that the Norad or any other inotrope infusion is going. That may, I think, probably alter the amount of drug that is going in, because we are pushing fluid at 300 ml per hour, or maybe 300 ml in less than 30 minutes, while the Norad or dobutamine rate may be just 5 ml per hour. That may cause excess drug to seep into the system at a very quicker pace. So it is important to check for another axis for fluid bolus therapy, and keep another axis for inotropes, and that axis should not be used for administration of fluid bolus therapy. And maybe one more thing is, sometimes the quantity of medication that we administer may be very little, let's say 0.5 cc or 1 cc. Whereas the extension line or an IV line or an extension tubing may be 10 centimeter or 20 centimeter. So if the 0.5 cc may remain in the tubing itself without entering the bloodstream. So it's always important to flush the line after administering a certain medication to make sure it has entered the bloodstream. These are some of the things that we face challenges, and we keep educating new sisters. And now that a lot of nursing initiatives are being taken up, such as these, we have more better trained sisters who are coming into the ICU compared to maybe, let's say, a few years back.
Yes. As of now, we are getting advanced with so many other like infusion pumps and syringe pumps, which are advanced technologies that we are using.
Right.
Do you think that this is also decreasing the effort of nurses or other healthcare personnel to do the manual math and to forget the formulas and just going and depending on the system?
Correct. As you rightly said, machines always are built to make human lives more convenient and more easy. But at the same time, we should not become so dependent on machines that when the machines fail, even we fail. We have to be as a backup, because machines are allowed to fail, while as humans, we have very little margin for error, especially in settings such as ICU or emergency. So while we use machines for our comfort and our convenience, we always have to be prepared. We are the backup point for the machine. So we have to be prepared with the adequate knowledge. We cannot let our minds get wasted. We have to be still be abreast with all the basic principles and be ready to kick in whenever the machines are not functioning well. Because a lot of times now we have these fluid infusion pumps. We set a rate of 150 ml per hour. And sometimes the machine may not be working, the battery alarm may not be going off, or there may be a power cut, the UPS may not be kicking in. So at such circumstances, we have to be ready enough with our own knowledge and awareness to replace and substitute the machine. Though machines are convenient, we should not be totally dependent on them.
Great, sir. Thank you so much, sir. So, and I think Bindu, do you have anything that you wanted to make our audience to get a little hands-on practice through this webinar?
Yes.
So you're going to have any kind of questions for them?
Yeah, we have 5 questions based upon all 5 different types of formulas. So if everyone is ready, we are going to share the questions now.
I think the audience are mostly interested in this. Hope we will also have a live posting, and also we will have the live polls which are ready. So you can post the polls. The first poll will be ready now so that you can all answer in the chat box. Bindu madam and our expert panelist also will be just cross-checking with your answers, whether it is right or wrong. So putting forward for you to the digital team, Mr. Pavan, we are ready.
Yeah. So they have a first question for them. So it's ready. Doctor advised to administer tablet Ethambutol 600 mg and it is available as 200 mg per oral. How many tablets the nurse should administer? So we have an options of 2 tablets, 3 tablets, 4 tablets, and 6. You all can drop your answers. We are waiting for your response. Okay.
I think there is also a poll coming up in the chat section. Also onto the live, onto your screen, you can see that and you can answer it.
3 tablets. Yeah, when you look at the question, how many tablets you will administer, the now formula is required dose divided by stock dose, and your answer is, yeah, let's have an answer here.
Athira, Sindhu, Shanti, Syed, everybody are saying is 3.
3.
Zareen. Is it right, Bindu?
Yeah, it's 3 tablets.
Great.
It's right.
So most of them are doing good. Means you're making the amazing session.
Thank
So
you.
we are ready for the next question.
Yeah. So next question is,
I think still people are answering for the last question. Everybody are answering the same. I hope the second question they are waiting for.
yeah. Here is our second question. The doctor advised to administer injection heparin 5,000 units and available is 25,000 units per 5 ml. How much ml the nurse should administer for the patient? The options are 1 ml, 2 ml, 3 ml, and 5 ml. How much ml the nurse should administer?
So what is the ordered dose, Bindu?
Ordered dose is 5,000 units,
So available dose?
25,000 units.
So most of them are answering the question as 1 ml.
Nice. Which formula we should use over here? How much ml? Liquid medication formula. Required dose divided by stock dose into stock volume by 1. Yes.
So we are ready with the next question. I think.
Yeah. Shall we move on to the next question? Here is our next question. You have an order to administer 60 ml per hour of NSIV. What is the drop factor that you are going to adjust with an IV set of 20 drops per minute? The options are 16 drops per minute, 18 drops per minute, 20 drops per minute, and 22 drops per minute.
Can you just repeat us the available dose and the order dose?
It's about drops per minute we have to calculate.
Yeah.
NS, the flow rate mentioned has 60 ml per hour, and the IV tubing set is 20. The drop factor is 20. Drops per minute we have to calculate.
Great. So for the drop calculation, we will be having the formula as total amount of fluid multiplied by drop factor, which will be divided by the time and multiplied with time in minutes. So what would be the answer?
It's 20 drops per minute.
Somebody is saying, Lavanya is saying 80.
Okay.
Sumitra is saying 3. I think a few people are still answering the first and second questions. Okay, few are telling 20 ml per hour, 60 ml, 80 ml.
80.
Yeah. So doesn't need to worry. You can also do practice onto the same formulas after the session. Also, this session will be live available after on Facebook. So you can just visit our Yashoda Hospital's Facebook page and you can just do the practice and also keep that in the comment section. We will also correct it later after the session too.
Okay. Shall we move on to the next question?
Yes, I think, yeah.
Okay, we'll move on to the next question. Our next question is, a patient weighing of 60 kgs has an impaired renal function advised to receive 5 max per kg per minute of injection dobutamine, and it is available as 250 mg in dilution of 50 ml of NS. What is the ml per hour we are going to adjust in the syringe pump? I repeat again, patient weight 60 kgs and the advice is 5 max per kg per minute. Available in our hand is 250 mg.
So the formula would be?
Required dose into patient body weight into stock volume into time period 60 divided by stock dose into 1000.
So what would be the required dose here?
5 max
And the
into
body weight?
60.
The time period?
60.
So then volume?
Volume is 50.
So what is the stock dose here?
250 into 1000.
So why do we use 1000 there?
We are converting mg into max.
Great. So we have given the complete clue. Only thing is they have to just give us the answer.
Yeah. They might be thinking it's in a big formula. They will take time to calculate.
Yeah, we have got a Swapna Sampa is saying that it is 0.6 ml per hour.
I
something
think
was
it might
asked.
be a type mistake.
Okay.
Yeah.
3.6 ml, Asha Balu.
Yeah, it's right.
Great. Navjot is again the same 0.6 ml. I think people will go wrong mostly in the inotrope calculations when they're multiplying with 1000. Even 1 0 they miss, automatically the number comes down.
So here I want to give some suggestion that whenever they're calculating numerator, they have to calculate first and they have to write the figure. Same way, denominator they have to calculate, then only they need to go for the division. Altogether, sometimes if they are dropping together also, some of the calculators each may show their wrong value. So it's better to calculate numerator first, then go for the denominator, then go for the division.
Yes.
That would be better to get a correct answer.
Rajesh, Jyoti, Mary, Chinky, Durga, Rajashri, most of them answering 3.6 ml per hour. Shanti, Renuka.
That's great.
Great. So I think Bindu, you have done the amazing presentation on calculations made easy. Hope after this session, people are going to calculate the dosages accurately in their units. Hope Dr. Sai Kiran sir also was really active, and you have given us the most of the insights about the calculations and where we really go wrong in dosage errors and all. Thank you so much, sir, for your
Thanks for
insight.
having me, ma'am. Congratulations to both of you. Very good job.
Thank you, sir.
And Bindu, anything that you wanted to give as a take-home message for our nurses?
Yeah, I would like to give a few general tips where they have to remember before administering any drugs. So let's have a look onto the general tips. First important thing, cross confirmation of the doctor's order prior to the drug administration. I suggest everybody unknowingly do not administer any drug. And if another person has prepared the drug, you should not go for the drug administration. You should know about the action of the drug and also the immediate side effect. Do not administer any drug without any knowledge on that. And the next important point is we have to follow the triple check. When you have taken the medication from the medication box, you have to check whether you have taken the correct medication with the correct dose. And whenever you're preparing the drug also, you have to look again to the drug name. And after administration, before discarding, again, you have to cross check whether you had administered the correct medication within a correct dose or not. Triple check is mandatory for the medication administration. Always cross check with your senior staff. I repeat again, we have to cross check the medications, whether you had picked correctly or not, your dilutions, preparations, everything. We need to have a cross check. And it's better to have a knowledge onto the commonly used drug in your area. See, you will be having posted in your surgical areas or as in a neuro ward or in ICUs. We will use in a common drugs and we should be aware of those drugs. And everybody try to develop a motto that at least 2 new drugs you will learn for today. So that make it a habit. You can completely learn all the drugs. It will be very easy and can prevent all the errors. So this I would like to share. Thank you. Thank you, Pratisha.
Thank you so much, Bindu. At the final note, I would like to thank our Director of Yashoda Hospitals, Dr. Pawan sir, who has given us this platform for exploring our nursing education webinars, and our DMS, Dr. Lingaya sir, and our AVP, Dr. Amar sir, and our GM Nursing Education, Vimla Prasad ma'am. Last but not the least, I appreciate the best support from our team Nursing Education and Mr. Pawan from Digital Marketing. Thank you so much, everyone. We'll be coming up with the most interesting topic for the next week. Please stay tuned. And in case if you like our webinars, please do share on your media platforms. Thank you, everyone.
Thank you.
Good day.
Thank you.